Good morning, everyone, and welcome back. We're on part 3 now of Dr. Beeman's speaker series on the ACE study. We were just chit-chatting in part 1 here. The study looked at variables in the home, mostly around violence and treatment of parents and so forth. Children could also have received some of that behavior, but how that population in California showed certain patterns later in life of what those home lives can result in. But there was some concern that maybe the sample size wasn't reflective of the general population of America. So, or more diverse population. So the Philadelphia ACE study, which was Dr. Beeman's part 2 last time, looked at now the same variables and more. It expanded. She demonstrated with us last time as we went through the exact prompts. But it looked also now at Philadelphia, which is more urban, and many of the same variables were witnessed as they did in the original ACE, but it also revealed some new information that they didn't even look at maybe originally. And so now we're on part 3, which is community violence and how that's a public health crisis. And Dr. Beeman and I were sort of talking a little bit how this stuff can fluctuate based on other events that are happening in society that may promote people to become more violent. And we mentioned things like, political elections and stuff where you have people now having to take extreme sides, and then their answer sometimes is a level of violence as their answer. So Dr. Beeman is going to dissect some of that today and hopefully make connections to what she discovered in the ACE study for us to hopefully see how we can hopefully remedy some of this in our own communities. That has to be part of the solution. We can't always wait for the government to go do something. It is often community-based solutions because they're also community-based causes. I'll step out of the way, Dr. Beeman, and let you take over.
Okay, thank you so much. I was telling Kevin that of the 4, this is probably the one that is, he said, serious. It is probably the one with the most startling and the most disturbing statistics. So hang on, because the next one has some positive statistics, but I'm going to throw a lot of stuff at you with this. In my land acknowledgement, I took this picture of this beautiful blanket. I think some of you know I like to hang out at the Cherokee Trading Post in Seversville, Tennessee. As a matter of fact, I think my car just automatically goes there anytime we're in Tennessee. But this was just a beautiful blanket that had 4 animals, 1 bird that live in America. The bear, the wolf, the buffalo, the eagle. They're usually minding their own business. But you know what? When they get a little inflamed, infuriated, aggravated, they can be very violent. And so I decided in the land acknowledgement to acknowledge that the original people who lived in the land on what we call Turtle Island knew how to inhabit the land and coexist with animals that sometimes get riled up, and knew how to de-escalate them. I don't know if anybody ever saw Dances with Wolves, but that was about one guy who they call Dances with Wolves because he was able to coexist happily with a dangerous predator. So there are predators amongst us, or people who have the potential to be predators, but this is going to be about how do we coexist in a community with people who have the ability to become predators. So I thought I would show this, keeping in mind that the original inhabitants of the land were able to keep the predators coexisting with them in a happy harmony. So again, thank you for the introduction, Kevin, and for this opportunity to speak. I think everybody knows I'm the chief nurse administrator at the School of Nursing and Health Sciences. I'm also a forensic nurse, and people ask, what is that? Sounds like I do CSI work. And I can. That is one of the things that forensic nurses do. But we actually work with what we call victims of trauma and violence. I like to call them survivors of trauma and violence because that's the positive spin on it. But I help those victims to become survivors. And specifically because I'm a mental health nurse, I work on their mental health. And that's why I'm doing this series. We're looking at what happened to them, not what's wrong with why are they broken? But what might have happened to them in the past that traumatized them? And looking through who has come, you all are either instructors or you're creating faculty development or you're working with the students in an advising and recruiting capacity. You are working with traumatized people. I'm working with traumatized people as a parish nurse. I don't think any parish nurse has a parish doesn't have traumatized individuals in it. And so they're always traumatized individuals that we're working with, and certainly public health nurses. And I've been a public health nurse for quite a while here. We're working with the public, with the community, and there are traumatized individuals in our communities that need what we call trauma-informed care. So the goal for this series is to understand the findings of the original ACE study, which we did in the first session, and I think most of you were here for that, or hopefully listened to it. And then we looked last time very much in depth, question by question, through the Philadelphia Urban ACE Study, as it's called, and in the hopes that it would help you to understand the long-lasting impact of violence on children in particular, because it was looking at the first 18 years of life. And so now the next two sessions are going to look at the upsurge. Yeah, there's the bad news. There is an upsurge in violence in our communities. And the last session will look at strategies to improve it. Now, I actually took this picture. All of you that know me pretty well know that I'm absolutely enamored of penguins. And this was right after the little penguins had hatched a few years ago, 5 years ago now. I went to the Falkland Islands, and I was this close to those penguins. I was wearing a yellow parka, and I'm a rather big person, so I think I was a scarecrow, keeping other predators away, and I was able to protect this little colony of penguins. That's why you see some of them sleeping. It's like, oh, look, there's a scarecrow. I can sleep. But these penguins actually live happily in a colony, and they actually exist to nurture the young, which is what all of you do. This is your purpose at Aspen, is to nurture our students, protect our students, see their needs, meet their needs, and do it without picking on each other, right? This is what we do. This is our community. So we're very much like a penguin colony. So today I'm going to actually impress upon you, I hope, that violence is a community violence in the community is a public health crisis. Now, the reason I'm giving you these startling statistics is if you're going to actually do something in your community after we meet on December the 19th, same time, I don't know, not same Zoom room, but sort of the same group probably. When we talk about solutions of community violence, if you're going to take these solutions forward, people are going to say it's not a problem. And I want to arm you with statistics. It's a problem. And if you don't want it a problem where you live, then we need to put some solutions in place because it's getting pretty ubiquitous. So in the previous sessions, we did talk about the ACE study that was done from 1995 to 1997, and we found some flaws. And then last time we looked at the Philadelphia ACE study and compared the two. This time we're going to look at violence. And drill down on the effects of mistreating children or having children be in a dysfunctional or neglectful or abusive household. What are the effects? The effects are violence in the community, which then cycle back to more trauma for those kids. And so it's sort of an endless cycle if we do not break it up. And that's what we'll talk about in the next session we get together. I was at a conference when somebody used this slide. I think this is one of the best slides I've ever seen. It's very jam-packed with information, so I'll spend a few minutes on it. But if you wanted to take out your camera, it's based on the CDC information. But it talked about the individual risk factors that were caused or that were correlated with high ACE numbers. So if you had a high ACE number, the individual was more likely to abuse alcohol and illicit drugs, was more likely to have a disability, a mental health illness, chronic medical conditions, have poor non-existent interpersonal relationships with adults, because adults had mistreated them when they were kids. That makes really good sense to me. They had poor self-esteem, and so they had early onset sexual behaviors and really bad peer relationships. they didn't really understand what normal child development would look like because they hadn't had it. And so they had a lot of abuse and neglect in their family. And so guess what they did? They parented that way. They became parents at young age. They frequently were single parents. As was pointed out by Kevin, they frequently were low income and low education. There was a lot of parental stress. They tended to discipline with violence. And they didn't have a lot of supervision as a child. So they didn't learn the wisdom that I did perhaps from my parents and you learned from your parents. And there just wasn't social support for them. So they didn't really even see the government as a friendly, parent. So what did we see in the community where there were high ACE scores? Well, here we go. And here's where the money hits the road. If you don't want to spend a lot of money in your community, you need to address these risk factors, because where there are a lot of people who are traumatized, you see high crime rates, high poverty rates, high unemployment, a lot of access to illicit substances. The community just doesn't care anymore. They don't have a lot of activities. The housing is unstable and there's food insecurity. And then I really thought that this pyramid was interesting about from conception to death. Even prior to conception, many times these children with these negative childhood experiences come into family historical trauma, that their ethnic group has a history of historical trauma, or even their generation or their parents sit around and talk about how negative it is to live in America, et cetera, et cetera, et cetera. And then they're born into, one of the things that always amazed me when I worked in obstetrics is all babies come into the world more or less the same way. And then the world they go into is so different. The zip code that they leave the hospital and go to makes all the difference in their trajectory. So the social conditions that little baby goes home to make a difference. And then those adverse childhood experiences actually disrupt the neurodevelopment, actually then disrupt their ability to connect with others. And they start, and you're going to see some startling statistics about what I'll call risk behaviors, which then lead to disease and disability and social problems and early. Like I said, this pyramid is just really impactful. If you could get that in the hands of people who make decisions about money, it really says it all. So we talked a little about the Philadelphia project that was done from 2012 to 2013. It looked at the stressors that exist in the communities. We knew that there were stressors in families, but what are the stressors in the communities? And I didn't drill down to the statistics, but here they are. It found that 40.5% of Philadelphia adults had witnessed violence while growing up. And over 1/3 of them had reported some kind of discrimination. And again, this is what they consider discrimination based on their race or ethnicity. And almost 30% felt unsafe in their neighborhoods. Can you imagine not feeling like you could even go to sleep at night because it's so unsafe to live here? And then, as we said, almost 40%, which is what the CDC study, remember, it had 2/3 had 4 or more ACE studies, and this one was 37% said that they had 4 or more ACE studies with that. So the findings from this study suggest the need for services that address the environmental factors, and that's really what we're going to talk about a lot next time. So how did they compare? Kevin sort of gave a summary. The original CDC study, and they call it the BRFSS, that's a fancy word for it, was a telephone survey, okay? It was basically white, non-Hispanic, middle class with high school, more than high school education, and 3 out of 4 participants were white. They were highly educated on the whole, or more so than the average American. And what they found was that they really weren't very diverse. The Philadelphia study, however, found that only 2 of the 5 residents were white, 38.8%. So now you're seeing more representation from Black and Latino members, and that less than half of the adult population completed high school. So it was more representative of, at least of Philadelphia, but probably more generalizable to, the United States. So I hadn't shared this with you, but Fellini and Andra in 1998 took the ACE study, which, remember, had just come out then, and it actually studied and analyzed, well, what does this mean? And what they found out is that the children who had been exposed to these ACE elements, the adverse childhood experiences, had risky health behaviors, and it was dose related. And by that, I mean, the more you were exposed to these, the more risks you took. So there was an increase in physical inactivity leading to obesity. There was an increase in smoking, poor self-related health, multiple sexual partners. And that's, remember how they asked how many partners in the Philadelphia study, and sexually transmitted diseases. Remember, the Philadelphia study asked a lot about that. And then increased risk for alcoholism, drug abuse, depression, and suicide attempts. Again, the more exposure you had to these elements, the more likely these things were to happen, implying that interventions that interrupt the amount of exposures have a positive effect on the outcomes, whereas allowing it to continue as it was. I share with you, and I think all of you heard last year, that I was exposed to extreme violence, war, in 1967. But it was a fairly brief part of my life, and then I was reunited with my family, and it was a healthy family afterwards. So that dose, while intense, was short-lived. But if I had spent my entire life living in a violent neighborhood, then I might have been at more risk for some of these behaviors. Then they looked at memories, and I thought that this was sort of interesting, that how a person perceives and remembers the experience also makes a lot of difference. So early interventions to help them cope with the memories, such as debriefing, and, if we could possibly get people into Gaza to help these children process some of the things that have happened to them, they might not turn out to later commit acts of terrorism. Because what happens is, if you don't have interventions, then they tend to see these memories as highly emotional, and they see their childhood as very negative. And seeing their childhood as very negative tends to lead to these disorders as well as these risky behaviors, if that makes sense. So if the memories are not processed well and are really powerful, again, dose related and intensity related affects how intense the outcomes are. And then I just put this out here. Our kids are dying. Look, little kids and puppies, right? Or kitties, if you're a cat person. More and more children are dying of gun deaths and overdoses in Virginia. It is absolutely epidemic here, the opioid overdoses as well as the gun deaths. But in 2020, it became the leading cause of death in Americans 1 to 19, surpassing motor vehicles. I carefully put the kids in the little car seats and all, to try to protect them from motor vehicles. It makes me nervous to have a kid in the car. I do everything I can to protect my kids, the grandkids, from motor vehicle accidents. And yet, are we locking up our firearms? It continued into 2021, when guns claimed a record 4,752 young lives. It's just absolutely inexcusable how many kids are killed with firearms. Child maltreatment also exacerbates delinquent behavior. And so maltreated children are at risk for what we call juvenile delinquency and for future recidivism. Okay, kids do foolish things maybe once. They paint some graffiti on a wall. Don't you ever do that again. and then they never do it again. But juvenile delinquency and recidivism is they just chronically keep doing these things at probably a call for attention for what's going on in their lives. Early intervention, early prevention for juvenile offenders who were physically abused can prevent them to escalating to chronic violent offending. And the Manzoni and Schwarzenegger study confirmed that who they associate with, this sounds like my mother. I think, they must have gone to the same school. My mother always said, who you associate it with really makes a difference in how you turn out. And it's really true. Your peer associations, as well as your parental maltreatment, can make a very big difference in delinquent behavior. Cyberbullying. Wow. I don't know that I'd want to go back to, you can put in the chat whether you'd want to be a kid again. But, it was bad enough just having low self-esteem moving through the teen years, and wondering what people thought of you. Can you imagine if what people thought of you was shared and then 79 people commented on it? And I don't know if I'd want to be a kid now. but I love this description from the American Public Health article that preteens are caught in a preteen land between childhood and teen years. And they're the perfect age to be learning about the emotional effects of cyberbullying. It said even though middle school only lasts 3 years, 33% of public middle school students report cyberbullying daily or once a week. And I can tell you, in our households, my grandkids that are in middle school, absolutely, we're all bullied. So they're one of the 33%, I guess. I don't know. I did look up active shooters, and this White, it was an interesting book. His thesis was to compared to the rest of the timeline of the universe, things are getting better because Attila the Hun is no longer with us, and there are no longer huge genocides in Africa and all this kind. It was not comforting because I have all this other data. But what he was trying to show is, oh look, after the Route 91 Harvest Festival in 2017, the numbers are going down. Well, that was 2021. Notice that during the COVID years, and COVID was bad, it killed 1 billion people, but we weren't shooting at each other because we were locked in our houses. But then once we started coming out of our houses, do you notice that it's starting to gradually go up? And here's the bad news, because since White published his book about things are getting so much better, right? Obviously, the situation in Israel and Gaza hadn't happened yet. But in 2022, it saw the highest number of casualties, 313, including 100 people killed in the US in 5 years. That was in 2022. And people are asking me, oh, tell me more about it. Well, there were 50 active shooting incidents committed 94% by males. And we can comment about that, with Texas being the highest number of incidents. And before you all came, Kevin and I were talking about why. But there we go, Kevin. Arizona, you're safer in Nevada, okay? I don't know if anybody lives in Florida, New York, or Michigan, but you might want to rethink that. Second highest number of incidents, but they're all tied for the number of incidents, and they just can't catch up to Texas because everything's bigger in Texas, right? May was the highest month of incidents, right? Four of the shooters wore body armor. We think that these shooters are wearing all this body armor, but they don't seem to want to survive it. Teen involved multiple locations. That truly surprised even me. And 48% of the incidents, the shooter had a known connection to the location or at least one victim. In 50 incidents, 61 firearms were used by shooters, 29 handguns, 26 rifles, 3 shotguns, and 3, they don't know what came at them, right? 29 shooters were apprehended by law enforcement. 7 were killed. 2 were killed by armed citizens, which sort of blows that theory about the safest person is to arm everybody. That's what Texas says. Hey, let's arm everybody. And then when somebody starts shooting in Walmart, they'll the citizenry will kill them dead. Only 2 of these were actually killed by armed citizens. And we have a case here in Virginia that's interesting, and a Waffle House of all places, where somebody started something in a Waffle House and pulled out a weapon, and the chef, I guess, or somebody behind the counter pulled out his gun and shot the other guy who had shot first. Guess who they charged? The Waffle House employee, because somewhere in his it said he wasn't supposed to bring a gun to work. He was totally legally able to carry his firearm. It was totally legal. He had a concealed permit. It was the wee hours of the morning. I can understand why in that Waffle House he would want to be armed, but because he, as an employee, he was not supposed to be doing it, they charged him with involuntary manslaughter. And so anyway, this is the huge thing in Richmond is, why are you charging? And the other guy shot at him first. And so they're looking at the laws. But again, armed citizens are not always protected when they shoot in these situations. 9 committed suicide, and 3 still remain at large as of this year. So let's pause for a second, because I've done a lot of talking, Kevin, and maybe open up the phone lines. Which of these statistics surprised you all?
Everybody, you can just turn your mic on if you want.
Yeah, we're small enough. We can just chat.
I think, and I know folks are processing, but I think the one that I have been repeatedly reflecting on recently, and just made the comment, and you showed it here as one of the statistics, is how now the leading cause of children are firearm deaths. When I was growing up, it was always car accidents. Like you said, they didn't have seat belts, or you get a teenager who's out drinking and having fun with his friends. They're in that child group. When we say death of a child, they're 16, 15, 16, 17, 18-year-olds. Those are not good drivers. And it was that kind of stuff. It was never firearms. They were very low. But now, like you said, so that stood out to me, and recently has continued to stand out to me in a number of things that I've either seen in the news or I've been reflecting on in your speaker series in relation to this concept of community violence.
And part of that has to do with intervention. Before my daughter passed away, she was a videographer, and she worked with the Texas Department of Transportation. I'll tell you what she did, which I thought was a great intervention. She would actually go to the high schools, and she would pick out like the head of the SGA, the cheerleaders, the quarterback, the in group, and she would moulage them, and she would get a crashed car, and she would put it out front, and they would enact, right, these kids hanging out of the car with drunk driving, beer cans everywhere. Then, and she was afraid of heights, which is interesting. She would get in a helicopter and film them being rushed to the hospital, and then supposedly the parents were always notified, but sometimes that didn't happen, and it got a little tragic. But they would arrive at the ER, and again, volunteer ER nurses and ER physicians would treat this moulaged person as though they'd had the injury, and sometimes they even died. And then the parents would be called, and they would rush to the scene and say, "Did my little Johnny?" And a couple of times they didn't get the call that said, "Hey, this is just a drill." But anyway, so some of it was very real and very raw. And then they had somebody, he dressed up as the Grim Reaper, and he would walk in and beckon the quarterback, and the quarterback would walk off into the sunset and all this. Anyway, they would show that in driver's ed. So it's not, remember the foolish stuff we saw in driver's ed that was like from the 50s, that you sort of zoned out? No, they actually watch these films. Why? Because it's their quarterback, it's their cheerleader, it's their SGA representatives, right? Oh, there's Michael. Oh, there's Joaquin, this kind of stuff. So they're watching it filmed, and they're watching it in their health classes, their driver's ed classes. And it really has made a downturn, at least in Texas, in drunk driving among teens. So there are some positive interventions, and stay tuned, because one of my slides in the next one is about how to secure those guns at home. If you choose to have a gun at home, and I have to just say this, I've got some son-in-laws that are hunters, and they do secure their guns at home. So there are ways to secure guns at home, and I'll show you that in the next one. But is there something in the chat that looks like somebody said something?
Let me check it real fast. No, just a comment that someone had to run to another meeting. The other thing that I will say before you move on off of this slide, Nina, is I thought 50 incidences in a year wasn't very small in the United States. I mean, it seems
that's a
like
very good reason to go to the next
prevalent.
slide.
Yeah.
That was 2022. So on October the 26th, when I was putting this in for Kevin, I looked at 2023. Remember, the 2023 data is not out by the FBI until early next year. But this gun violence website, yeah, I mean, if you want to be depressed, the Gun Violence Archive website keeps track of all the mass shootings, the total number of dead, the total number of wounded, if it occurred at a school or university, which is important to us because we work at one, if it occurred at a place of worship, and the total days without shooting. Okay, so I went on October the 26th. As of, yeah, and I just want to remind you, a little flashback here, that 2022 is the highest number of casualties, and they had 50 in 2022. And this is why you thought that was low. Because in 2023, only until October the 26th, we had 565. Wow. So this will go on record, I'm pretty sure, as the worst year ever. Although they haven't compiled 2023 yet, but this person has on his website. I mean, meticulously done that. But look at the number of dead, number of wounded, number of mass shootings. Again, look at May, but July. What happened in July? Did it get hot in Texas? But it went up. But remember, May was usually the high, and this time July is going to be the high. But the total number of dead is 571. And thousands, almost 2,000 people have been wounded, including the shooter. Right now, I want you to notice, because we're going to have this discussion, the number of school shootings, though, and I hate to use the word only, is 6. Does that surprise you?
It does if we say that children are mostly dying from gun violence. But now we're saying out of 565, only 6 of these occurred in a school where children are, who typically, but they could be killing each other outside the school too. It doesn't have to occur in the school. That might,
yeah,
it might
I actually wrote my master's
in other words,
thesis.
they get in an argument and bring their gun out and shoot each other in the street, and it may not be school related.
Right. I actually wrote my master's thesis on violence on college campuses, believe it or not. And it can also be a university. So it's not necessarily little kids. And I have to tell you, the reason that number is, and I hate to say it, so low, there should be 0, okay, is that a lot of the schools have taken some really good interventions to make that safer than their homes. I'll just put it that way. Does anybody know what Uvalde did? First of all, does everybody know what happened at Uvalde?
Yeah.
They had a back door that didn't shut well. And they had, it was sort of a end of school, bring your kids, celebrate. Some school kids had gone home, but 2 of the classrooms did not, or one did not have a good lock. And one of the back doors did not have a good lock. And this young man, and I'll say it, had a gun in the parking lot. Whether or not he was seen or not, I've heard both sides of it, but he entered through this door that they said it wasn't propped, but it wasn't locked, instead of coming in through the front where he might have been seen. And the police officer was sort of patrolling, but not really paying much attention to this guy with the long gun. He got into one of the classes that connected to another class, locked both of these doors, and then just started shooting the kids and the faculty, the instructors, the teachers. and killed a bunch of them, obviously. And many of them bled to death because the responders, and there were a lot of responders, didn't go in. Okay, so learning from Uvalde, and this is Texas, okay, they have redone Uvalde, and I don't want to say it's a fortress, but they've raised that, or they're going to raise that school, and it's in a new location so that the kids don't have the traumatic memories. But there's only one way to enter the school, and it's hardened. Okay, so when you come in, everybody sees it, everybody knows who's coming in, there's only one way to come in, no way to prop doors, etc. And the recreational area, you know, where kids play, is in the inside of it. So kids are not playing outside. And I'll tell you, I had sort of a shock of my life. I have a daughter that teaches 5th grade in Northern Virginia. And I got something on my phone that said active shooter incident. And it had a little red tag where the active shooter supposedly was, and a little yellow tag indicating the classroom that my daughter was located in. No mother wants to wake up to that in the morning, because I really, first of all, no coffee. Okay. Secondly, just lost a daughter. Didn't know what this meant. Okay. But apparently, either somebody accidentally triggered it, or somebody saw something suspicious as the buses were arriving, and triggered this. And it's pretty complicated to trigger this alarm. So I'm guessing somebody saw something suspicious. But the alarm was triggered outside the building. So I thought, oh God, she's in lockdown. This is great. So she says, I've run down to such and such a room so I won't die alone. Now, what mother wants to see that? Okay. All right. So, but I didn't want to contact her because I didn't know if it would let the shooter know where my daughter was. So I'm just reading this stuff in real time as it's coming off, you know. And no, she didn't say she loved me. Tragically, she just was giving me this information like I worked for the FBI, you know. So anyway, and then she says, the students have arrived and I can't talk to you till after school. What? Mary, how would you feel as a mom?
That would be horrendous. That would be horrendous.
So this afternoon, in the afternoon, I talked to her and I said, let's talk this through. You ran from your room, exposed yourself to go to another room so you wouldn't die alone. Is that the policy? No. And she said, it got worse, Mom. Then I was not in my classroom, and they came over the PA and said, get to your classroom. And my thought was, oh my students are being let off the bus and going to my classroom, and they're going to be there alone. So then I had to run, expose myself down. I'm not talking about taking off clothes. I'm talking about, you know, if there'd been a shooter in the hallway, she's running down the hallway. And I said, does this make sense to you? She goes, not really, but I didn't want to die alone. You know, I'm like, but there's a reason why they say lock it down, you know. So it was a good chance to have a sort of rehearsal about this. But then, Kevin, you're going to love this. The principal comes in and does her 90-day evaluation. And she said, I could barely stand up. She said, I was still in fight or flight mode with all that. My little legs were jelly. You created a safe space that was inclusive for the children. She said, what? You know, but I'm actually sort of intrigued, aren't you? That not so much that you're telling Mom, I could pass on that, but that you're telling the officers where you're located, because they know that. I mean, supposedly she would have been with children if it had been any later in the day. They would have gotten off the bus and been with the teacher. So you know where the teacher is supposedly where the students are. The officers would know where to respond. So what do you all think about that?
I don't think they followed much of a plan.
You notice I didn't tell you what county, okay? But yeah. It was an interesting rehearsal, let's put it that way. But I thought it was a good use of electronics.
Yeah. That was what I was about to say. This scenario could have been, you know, different in a better way, you think? All of these incidences that we talk about, if there had been an increase of some video surveillance at this school in terms of all the hallways, every classroom should have a camera. Now, we're not going to do this because parents and everybody get all upset that somebody's looking into the classroom and watching their children. But imagine the security that that provides for you to be able to find an assailant who's running around somewhere in the school and you don't know where they are, unless you just turn on a camera in the rooms and find out, oh, he's hiding in room 314.
But
And
after
it
hearing
would also
these
cut down
data,
on other
wouldn't
things
you
that
want
occur,
that in your
like teacher
school?
misbehavior in the classroom if you're recording things, you know. But anyway, I think that would have helped. It sounded like they were using other kinds of technology besides video, though, in this school you were explaining.
Yeah, again, I don't know what else there was, and I obviously did not get the inside skinny. I just got the alert on the phone, but I actually thought that that was good because at least they're doing something here community wide. And I actually felt good. Okay, here's where the shooter is, and my daughter is like nowhere close. That made me feel good. And it made me feel good that the I imagine this all call went out to the police, to the law enforcement. So they would know this is before school started. So they would know where are people. But those people could then be quiet, right? So the active shooter, if there had been one, wouldn't have known where people were, but law enforcement would, which I think
It seems like it could do some geotexting, like everybody within a 2-block radius of this location who has cell phones passing through that area will get this text message that says, hey, be careful, there's a bank robbery or whatever that just occurred, and, you know.
Yeah.
Stuff like that, where we could use technology more to alert folks to the dangers that exist.
You're thinking, like I said, next time, come with your ideas, because we're going to need these data. I mean, that was pretty provocative. What? Oh, there were only a few last year. What happened this year? This chart should make every school board say, we got to do something. Now, there were none at places of worship, but I got to tell you, when I was in Texas, number one, right, for shootings, there was an officer that was patrolling the church where my daughter, you know, had her funeral. They pay an officer to patrol. And I actually sort of felt safe. I mean, it's like, okay, I can just worship here. You know, I don't have to worry, you know, what's behind me, who's behind me, who might be coming in, because they've had shootings at churches in Texas. So community response is what I'm trying to say. Community response is why those numbers are pretty low for schools and universities and worship, is because those three groups are really doing something about it. But look at this number. And that was October. I didn't go yesterday to see how high it is, but that's just scandalous. It's going to be the worst. So I want to plant this idea, especially before we talk next, and that is school nurses who provide care and guidance, you know, for traumatized children are not found in most schools. And that would be invaluable in terms of recognizing abuse, neglect, and dysfunction, and helping that child at a pivotal time through it, not when they're 35. So here's my open discussion. What is it like where you live? You've heard about, you know, we've got some mechanisms here in Virginia in place for schools, and I told you a little bit about Texas, but y'all don't live there. So what is it like where you live? And again, we're small, so feel free to just turn the mic on and talk over each other.
I live in Florida, and of course, I live in a very safe area. But just recently, I will say that the church that I attend, we had a meeting following the church just on safety, and all ways that they were going to lock the doors and have security, because they were concerned, because it's a very open church, a very accepting church, and they're beginning to worry that because of the intense hatred that's going on in Florida, that the church may be attacked. And so we had drills and everything to go through, and how to get down in the pews and everything, because they were so worried about it.
I love that. I mean, you just want to go and worship. You just want to go in fellowship. You just want to go and commune. And many of the members of my church are in the LGBT community, and they do express the same fear. That it's just, I don't want to say open season, but I think people are bolder about discriminating against people, and
Yeah.
they don't mind, quote, taking out people who, you know, are allies too. So
Exactly.
I'm sorry. I really am. I'm sorry that you have to deal with that. But I'm also glad that, you know, you're thinking about how to stay safe.
Yes. Thank you.
You know where I live, Nina, which is in both Phoenix, Arizona, which is the 5th largest city apparently in the United States. So, you know, we have our level of crime here. It's from murders, you know, it's not just small stuff. And also live in Las Vegas, which is not as large, but because it's Sin City, and you get people who get drunk and do things, and they have that level of crime and so forth there. So I would say neither one of those locations are necessarily the most ideal in terms of minimizing my exposure to community violence. However, where I grew up as a child, and we were sort of talking about it's your exposure to things as a child that then impact your outcomes sometimes later in life on that list of risks that you showed. My home upbringing was in a very super small country town. It was 3,000 people who lived in the entire county, and there was only one high school. So everybody in the entire county, not 3,000 people were high school age. It only had about 1,000 students in the high school, but that was the extent of that entire county, one high school. So it was small, very safe. People didn't lock doors. But the interesting thing was, I literally was thinking this just the other day too, that during deer season, we would drive to school in our truck with a deer rifle in the back window and park it there on the school ground, and it was no problem. No one would even blink about it. They wouldn't even said anything. They would have thought, of course, you're going to go deer hunting after school today. That's why you brought your stuff. You know, the principal and the teacher was going to go deer hunting after school that day too. So in that scenario, you know, when you were given those statistics, now you went in and said Texas and Arizona and some of these are the higher risk states on that 565 shootings. I was wondering how many of these are clustered more so in places that are just more populated. So maybe in cities, we know there's more mass shootings than maybe in smaller towns. I don't know, but this is where I think your question is going to now is, do we notice differences in our local influences that can result in our exposure to this potential risk to ourselves?
And a lot of it comes back to the ACE.
Yeah.
And how the shooter feels harmed. A lot of these shooters have felt like they were harmed at school. They were bullied at school. Remember the Sandy Hook one, which how can you forget? He didn't have any beef with the first graders. He didn't know the first graders. He had a beef with his being bullied in elementary school. And the Uvalde shooter, he had a beef with that room. He had been bullied in that room. So when you do the debrief and the profiling, it's often a place where something happened, like this guy that went and shoplifted in Macy's, and he was confronted by, this was yesterday, and confronted by some security people at Macy's, and went back and then stabbed them. That's somebody who has an issue with the location or the people in the location. They're going to go to that location no matter what. In Virginia, we had a city hall, for example, that was done. And a lot of times if you fire an employee, then, you know, they'll go back there. So many times it's the location, not necessarily city, or isn't that funny? Not necessarily, hey, is a big city thing. And so sometimes we have to decide, first of all, which locations we want to harden, and it may need to be schools, you know, and it may need to be, I remember I was a victim advocate, and I was telling Kevin, my office was right inside the door. dispose of the deputy sheriff at, you know, machine that you go through to make sure you don't have a gun, you dispose of that person and you're in my office. It was that quick. And the Commonwealth attorney was right across the hall. So why not take out everybody in those offices? Well, after that happened in Virginia, they moved the victim's advocate. So you almost can't find it. because if you are a perpetrator, you want to find that victim in the city hall, right? Before court. So you're going to come into the court building, you're going to try and find the victim that's about to testify against you. So they actually physically moved the office and made it so it's not real visible. I mean, the victim is escorted there, so they know where it is, but a perpetrator, it's not neon lights, you know, victim advocacy and easy to find. So there are things that we can do by just thinking about what is in the mind of the perpetrator. And unfortunately, after there's an event, we take it apart, you know, sort of doing a psychological autopsy of what happened and say, what do we need to harden? And that actually will be probably what we'll discuss next time. Where do we need to harden? Dr. Reagan brought up a very good point. Churches, people just get really inflamed about religious differences, and we may need to harden the churches. We definitely need to harden the schools, and a lot of that has to do with bullying and this prior bullying in the schools. Even if right now it's not happening, it may have happened at some time in the past, or when an employee is terminated because we had an incident here. It was actually a TV station that fired a cameraman, and he went out on I guess he couldn't get back into the television station. He went out at a photo shoot in a beautiful place called it doesn't matter, but anyway, they were shooting out at a lake and all this, and on camera shot the cameraman and the person, you know, who was giving the interview, and then the interviewer, and killed two of them. Didn't kill the person giving the interview. And then we chased him up 81, and finally a police officer shot him dead on the side of the road because he was heading for DC with every intention of doing who knows what. So, you know, his anger was directed towards his previous employer. So that's actually what my research showed in my master's thesis, is that it's directed. This is directed anger. But then you have people that will shoot up a police station because they're really just trying to die by the hands of law enforcement and go out with flair. So that's where the psychological autopsy, that's some of the things that forensics does. Is to look at that. So I know that the clock on the wall says that I'm running out of time. So in conclusion, but it's not the conclusion because we don't have yet. So we got to come in 2 weeks so we can solve all the world's problems. But not only is there a crisis of abuse and neglect and violence in homes, but I hope that I've convinced you that there's a public health crisis, especially this last year. That people who might provide help in keeping schools a trauma-free, safe zone are not more cops, you know, but more school nurses, people who are trained in trauma-informed intervention. So next week, we're going to look to seek solutions. I thought you would get a giggle out of seeing me actually in uniform. This is the Honor Guard uniform we use here in Virginia. So that's what I do when I go in the Honor Guard. But happy to talk to you about anything or send you all these references. I'll hold it up for a second if anybody wants to take a picture of it while we're recording. But I would say that all of these are excellent studies, and they all come to the same conclusion. We need to solve this problem, which in 2 weeks, I'm hoping you'll bring ideas and we will just troubleshoot. So I'll turn it back over to Kevin. I know Kevin has things he wants to say.
Actually, we only have a couple minutes, so I'd rather, if anybody else has anything to say, they can add to today's presentation. Sometimes you don't have to be put on the spot. Yeah, that was quite a dramatic leap in 1 year. I mean, that was a 10-fold jump from 550 in 1 year to 500. You know, we're not even done with this year yet. When you mentioned that newscaster who went out there to that news site and shot 2 of those people, you know, that would not have been considered a mass shooting, because you have to shoot, I think, 4 or more people, isn't it? Is it 4 or 3? Anyway, that's the only thing I sometimes have. You know, when we think of a mass shooter, we think of someone who is intentionally going to go to a spot. They've pre-thought about this, they've planned it, and they're there to shoot and kill as many innocent people, random people as possible. That's what we think about when we think of a mass shooter. But you know, a bunch of those mass shootings are not really mass shootings. They're teenagers at a house party who get into a gunfight, and they're just spraying bullets at the crowd. They're not trying to kill a bunch of people. They're not trying to kill random friends. They're trying to shoot at the people. And now 3, 4, 5, 6 people get shot or killed, and that's considered a mass shooting. And they need to somehow separate those two. Otherwise, it makes it sound like there's 565 people running around into Walmarts and other places shooting people for no reason, and a bunch of these are teenagers and gang members and irresponsible people at parties and bars and street fairs who then just start shooting, and a mass bunch of people get killed, but that was not their intention.
But remember the correlation of high ACE numbers with risky behaviors, and it's dose related. So if we could intervene with these young people now, then, you know, maybe 2023 will be the high, and maybe we can pull those numbers down in the future because we intervened before these young people started in risky behaviors and attention seeking. That's what those behaviors.
Very terrible, vicious cycle, because like you said, your community promotes that, your home promotes that, you know, and so you go out and now you act that way. It's almost impossible to sometimes get out of it. This observational learning, this vicarious trauma, I would call it, where you're watching it take place with someone else, you know, and it still traumatizes you, affects you. It still gives you that ACE, one of those variables of having seen someone stabbed at least once in your, you know, not necessarily in your home. It was in the community at a house party I went to, right? And now I witnessed a mass shooting. I don't know what the dose level of that would be, but a lot of this stuff is very sinister. In other words, the people, the victims, the survivors of this home trauma, there's not like a, you know, a scarlet letter that you wear around and say, I'm the one who got too much dosage and I'm dangerous, you know, that they act just like everyone else and they're normal like everybody else in every other way until one day they can't take it anymore. Or it's so sinister that you don't even know, it's almost unconscious, conscious. You don't even know that you have these tendencies until you snap, you know, or whatever, or you don't realize the risk factors. As children, I think children don't have good, rational, logical thinking when they, you know, they're very impulsive. And so you mix impulsivity now with a history of watching violence. And that was the other thing through all of this. I still believe the biggest danger is not always what happens in the home or even the community anymore. It's what happens in the media and all this social exposure on my phone that I'm constantly, you know, if I'm not at home or I'm not out in the community being exposed to some of these things on a continuous basis and I get a break from it, that's the dosage. But if I have a phone and it constantly is dinging me all day long, I sleep at night with it by my side, and I'm a teenager and I'm constantly, you know, that's to me the super danger here. The ACE is bigger than that to me. The ACE is bigger than those homes that have violence, because now in nonviolent homes, you can be exposed to violence through media, video games, and etc. I know this has been the sort of, you know, the battle in a long time with, you know, violence in music, violence in video games, violence, and we blame violence and those things for resulting in the violence in society. And I don't know that that's all of it. It certainly is part of it, because if you can't get away from it, you know, and with media, you can't get away from it. And all the other situations, I can leave the house. I can get out of that community. I can do some things eventually to change that. But with social media, you can't really escape it unless you get rid of your phone. And that's impossible. Yeah. So anyway, I don't know if it's going to get better.
Two of these people have headphones on right now, so I don't think that's.
Hey, look at what's happening in the world. Is violence is the first response. Violence is considered the solution, sadly, and it sets that world level, that world community now that we're talking about, not just our local community, but there's a world community where these images and these behaviors are taught to us on a global
Well, next time I'm going to teach you all some positive interventions you can do at home and in your community, because I want to head on a happy note.
Yeah.
But I mean, I love that Dr. Reagan shared some of hers, ideas. Bring your ideas that have worked in your communities and let's share away. And those of you that are listening in the recording, share ideas or send them to me so I can share them, because we got to solve it next time, right?
All righty. Nina for president. We'll see you next time in 2 weeks.
Stay safe.
Bye-bye.
Bye-bye.